This is the committee to decide if spawning should be taught in school. Fish sex education. Well, we did the male system. Talk about the female system. This part of the ovary would be where the egg nests are. They migrate out. The tissues are very loose in an ovary. This is they pick up follicle cells. This starts to form a space. That's a space. It gets here, it collapses, it spits the egg cell, see with some follicle cells around it out there. This goes into the oviduct, the sperm meets it. This is not an egg cell. This is not an egg cell, but it's going to do its first division there. And this is not an egg cell, it's going to do its division there after the sperm nucleus gets inside. So there's the ovary. This is the oviduct, which just has an opening toward the part of the ovary where ovulation happens. It is possible for an egg cell to be released and miss the oviduct. There's a current, but it can miss, especially if there's damage to the system, in which case egg cells can wind up floating inside the body cavity. They can be fertilized out inside the body cavity. And they can implant in the body cavity outside of the female system. Is at any time there's implantation outside of the uterus, that's an ectopic pregnancy. The extra-system ectopic pregnancies are particularly unusual. And of course, if implantation happens in the right surface, you can grow a full placenta and get a whole fetus that way. But if it winds up someplace where it can't really grow a full placenta, in the oviduct is one of those places, but also, anywhere out in the abdominal cavity, like the outside of the intestines, the liver would support a placenta, the stomach would support a placenta, the outside of the uterus will support a placenta, but there's a lot of structures in the abdomen that will not support a placenta, and that would just, compromise your intestine or wherever else it tried to implant. But that type of ectopic pregnancy is unusual. A tubal pregnancy is not that unusual, especially if for some reason or another the course down the tube is restricted. Anything that interferes with that ciliary movement to move the fertilized egg down and get it down here before it implants can be a problem. So sexually transmitted diseases that affect these linings are an issue. And of course, we talked earlier about how nicotine can stall the movement of cilia and stall the fertilized egg, the embryo, in this tube and get implantation. And this tube, you can just about fit a human hair up the space of this tube. That's how small it is. Any kind of placental growth in it is going to just rupture it. So, the female system. We've talked about the ovaries pretty much already. They generate egg cells, they generate estrogen and progesterone. There's also female primary sexual characteristics that absolutely have to work in order for babies to be made, and secondary sexual characteristics that are associated with puberty and are probably important in mate choice and stuff, but are not absolutely necessary for babies to be made. One of them's kind of in the middle of that, is that I mentioned that one of male secondary sexual characteristic is the broadening of the shoulders. The shoulders grow faster through puberty than the rest of the skeleton does. In females, the hips grow faster. And that does aid delivery, the broadening of the hips, the expansion of the opening in the hip bones. Not absolutely essential though, so whether it's a primary or secondary characteristic is a little iffy. Breasts are a secondary sexual characteristic, kind of a mysterious one, since in other mammals, breast growth really only happens on demand when you need to nurse babies. Why females grow a mostly fatty breast and have it through their entire adult life, one assumes it's some sort of sexual signal, but the significance of it is all over the map. You know, many people have many guesses about this. It also turns out that females develop a very thin layer of fat under the skin, and that may also be a sexual signal. It may make, produce a youthful appearance and make a female more desirable. There's a lot of thoughts like this. But it turns out that fat cells produce female hormones, especially estrogen. And they may be very important for the system to function properly. So fatty tissue in the breast, fatty tissues under the skin may be actually a primary sexual characteristic. It turns out people that are anorexic, that starve themselves and get so depleted in resources that they actually use up the fat in their reserves, in their layer, in their breasts. One of the symptoms of that is the menstrual cycle just stops, or it gets very erratic, because the hormone levels are not what they need to be. The ovaries are still making hormones, but the secondary supplementation from the fat cells may not be up to keeping the system working properly. The ovaries sometimes develop cysts, where a lot of times that's a follicle that should have collapsed and gone out of business, doesn't do that, and you wind up with these bumps on the ovaries, and a lot of them, some of them produce hormones, some of them don't produce hormones, some of them for reasons I can't, as I read about it, nobody seems to know the reason. Some of them switch over to producing testosterone. There's also an association between cysts and diabetes, although the connection isn't entirely clear as to what's making that happen. But polycystic ovarian syndrome, a lot of cysts on the ovaries, is actually a very common condition in women. So we've got the oviducts. These used to be called the fallopian tubes. There's been a push in medicine to move away from naming things after people. Fallopian tubes were named after Fallop. Cowper's gland was named after Cowper. We call it the bulbourethral gland now. And also sometimes to move away from very Latin-y names like the vas deferens. And oviducts is just sort of Latin-y for egg ducts. And it leads from where the egg cells are released toward the opening down to connect it to the uterus. One kind of equivalent to a vasectomy is a tubal ligation. Tubal because you're using the oviduct, the fallopian tubes, it's an old name. And ligation actually is literally tying. And what they do in that situation is they take most of the oviducts out, but they leave enough connected to the uterus that they can tie them and then sear the end the same way that they do with the sperm duct. Now in this case, once you've clipped most of the oviduct off, the odds of an egg cell actually hitting that little bitty opening are almost non-existent. But the ovaries left in place will still be releasing eggs. They'll be ovulating every cycle. And you do not want sperm getting out of those tubes into the body cavity and getting to those egg cells. So closing off the oviducts during a tubal ligation is to block sperm motion through the openings, not egg cell motion through the openings. So the uterus is where implantation and development of a fetus should happen. The lining is much more built for that than other kinds of linings in the body. Yeah, you can get it to happen on the outside, you can get it to happen some places, but it's much more suited to it. It can contribute much more to making everything work the way that it's supposed to than other tissues in the body will. And it goes through a cycle every month. The theory is that because the system is open to the outside, you don't want to have a permanent nutritional lining, because too many things would get up in there, and it'd be too good a place for parasites to take up shop. So once a month, over the course of the cycle, the lining's built up, and then the lining dies and slides off and needs to be replaced. Anything that's gotten up there on the lining will slide off with it. During pregnancy, the opening is actually sealed off so that it's harder, more difficult for things to get up from outside the body up to where the fetus and the nutrition is. So we're going to talk a little bit about the cycle. So the pituitary sends a hormone, follicle-stimulating hormone, down to the ovaries and says, okay guys, time to start a cycle. Egg cells leave the egg nests, they pick up follicle cells. Follicle cells help put food in the egg cells, but they also make estrogen and progesterone in different amounts. The estrogen is primarily a signal to the uterine lining. The progesterone is primarily a signal to the pituitary that basically says, we heard you, we're working down here, leave us alone. And that's a real oversimplification, but that's basically what's going on. So the egg cell is building up food, and so that takes the first part of the cycle, like maybe 10 days or so. It's also migrating through the ovaries. It's fighting with the other ones so that only one gets ovulated in most cases. If you're having trouble getting ovulation, a lot of fertility drugs take the signal from the pituitary and amplify it. And so a bunch of egg cells leave the egg nests, and way more egg cells typically will get ovulated, because it's hard to get that exactly right, so that if you're having trouble ovulating any, you can just get one. Usually you're going to get, and multiple bursts very often are connected to this amplified pituitary signal. So estrogen goes down to the uterine lining and says, you got to get ready if we send you an embryo. You got to get ready to build a placenta if we send an embryo. So the uterine lining, which mostly has been lost, starts to build up again. So it gets thicker. It has glands in the lining that send little ducts up to the surface. It invades the lining with blood vessels. I'm doing this on purpose. There's spiral blood vessels that spiral up and go across this kind of spiral down. And it thickens. Good place to stick to, good place to get a placenta to build. And then ovulation happens. The follicle collapses. It shifts. It's still making estrogen and progesterone, but it's in a different proportion. And that different proportion still sends a message to the pituitary, leave us alone. But it sends a new message to the uterus saying, we've just put a cell in the system. By the time it reaches you, you got to be ready to go. Because the system is set up for pregnancy. So the lining kind of stabilizes, and the glands start to put a material on the surface that is very nutritional, so that if an embryo sticks to the lining, it can already start to pick up nutrition without having to have built a placenta and have all the blood vessels and stuff going. This is why, one of the reasons why the uterine lining is better than other places in the body to do this. So if there's no fertilization, if there's no embryo, then there's no human chorionic gonadotropin to tell the ovaries, keep cranking, and they stop. They gradually stop. The follicles shrink up, the estrogen and progesterone levels drop, and the uterine lining goes, I guess we're not doing anything this cycle, and it starts to, the lining starts to shrink back. The gland stops secreting. The shrinkage of the lining tends to squeeze those spiral blood vessels shut. And then the blood vessels tend to seal off at the base. And eventually the lining dies enough that it slides off. that lining is called the endometrium. And it's supposed to leave, it's supposed to go out through the vagina. That's menstrual flow. And some of the blood vessels are still, still bleeding. There's still some blood. It's mostly red because that's what the lining of the endometrium is, red. It's kind of a brick red, a deep red, as opposed to fresh blood, which is more red. But, so a lot of the menstrual flow is just lining, but also some blood. It varies a lot from woman to woman in that. And the progesterone levels have dropped. That tells the pituitary, okay, we got to start this over again. And the pituitary will send a new message to the ovaries and start another cycle. Well, let me write this and then I'll put it up. At the base of the uterus is this dome-shaped structure where the opening from the vagina to the uterus is. That's called the cervix. I don't know if people still use diaphragms. It used to be a contraceptive, a diaphragm, which was a dome-shaped rubbery piece of material that you would insert. You'd actually place it over this. Now, sperm are little bitty buggers, so they could get around it. So you would line the bottom of the cup with spermicide, so that if the sperm got around the edges and got up underneath, they would be killed. And that was a pretty effective contraceptive. There are intrauterine devices, IUDs, that are implanted up into the space of the uterus that seem to prevent implantation. Is that they definitely are good contraceptives. They work really well. Some of them are filled with hormones. Some of the old ones were just pieces of copper or copper and plastic. And they think just the presence of it produced enough irritation that you couldn't get implantation. But they're still in play. They weren't in vogue for a while because one of the companies that made IUDs, there's a string that would come out the vagina where you could check to make sure it was where it was supposed to be. Kind of give a little tug, make sure that it was, or if the string disappeared, that would be bad. And they changed the string from a copper string to a plastic string. And it turns out the bacteria from the vagina could migrate up the plastic string, get too far up in here, actually get out into the abdominal cavity and into the blood and cause septic shock. And a lot of bad things happen, not commonly, but it became a side effect of these. And they didn't know for a long time. It just seemed to be a brand new side effect of IUDs. And so they stopped putting them in for a very long time. You'll still find older doctors very resistant to it. Toxic shock's a bad idea. But they did eventually find out that it was the strings and change the strings. So they work okay. While we're talking about contraceptives, what a birth control pill does is it has a balance of hormones that at one point through the cycle is telling the uterus that it's a normal cycle. Build up, slough off, build up, slough off. At the same time, it's telling the pituitary that you're pregnant. So it won't start another cycle. So it's a slightly stronger message than the ovaries generally send. And in some women, they get side effects that mimic side effects of pregnancy, is that they get hormonal fluctuations in irritability and tender breasts and a bunch of other things. And sometimes finding the right mix of hormones in a birth control pill is necessary. But you don't want to find a mix that is too low so that you actually are ovulating, because the whole purpose of the birth control pills is to prevent ovulation. And of course, you've got the condom that covers the penis. I didn't know that I don't think I really need to explain that. This surface can pick up a virus, human papillomavirus, and the virus can cause the cells to become cancerous. Right? Viruses, DNA gets into the cells, messes with them, and you can get cervical cancer from exposure to this virus, which they discovered. The story I heard is that a general practitioner who for years, he was an old guy, and he had a convent with a bunch of nuns in it that were his patients for many, many years. And he realized one day when he was giving one of his other patients the news that she had cervical cancer, that he had never ever told a nun that. And he started to make him wonder, and then they started to look and found that cervical cancer is definitely associated with sexual activity. And for a while, if you had cervical cancer, it was assumed you had to be sexually active. Like, duh, they're cells that are dividing. They can become cancerous all by themselves, thank you. And so for a while, there were some teenage girls who got cervical cancer that got really, no, I haven't had sex, but nobody would believe them. It's rare. Is that if you have cervical cancer, most of the time it's going to be associated with the virus. And they have a vaccine for that is pretty effective and pretty safe, actually very safe. They still debate as to whether they should automatically give it to girls when they hit puberty. I said, no, that's an ethical question. It's a health ethical question. I don't know that you can get 4 pages of paper out of it, but it's an ethical question. And then, of course, the vagina is what they call the copulatory organ. And it does have some erectile tissue in the lining. It's got lubrication glands in the lining because it's connected to the outside, and it's a very moist environment, even at the least moist of times. There's a lot of organisms that are very happy living in there. And your immune system will react to them with an inflammation. You have vaginitis, and it could be an invasive yeast, which is a type of fungus. It could be bacteria, and it could be a protozoan. And those all react to different chemicals for treatments. So it's usually a good idea to check, because the symptoms are not that distinctive between the 3 different types. They usually take a swab and check it. Unfortunately, from what I've heard, is if you're prone to yeast infections, it's not uncommon as women to go into the doctor and go, it's a yeast infection. I've had a bunch of these. You don't need to take a swab. I know it's a yeast infection. Just give me what I need for a yeast infection. And they go, no, we got to take a swab and check it because we don't trust you to know what's going on with your body. Sorry. And then you have the external features, which change to become the male features. A fetus is the default is female, and to produce a male, things change, like the vulva and the scrotum actually grows out of what's would have been the mons, and the clitoris will enlarge and engulf, surround the urethra to become the penis. But the clitoris does have erectile tissue. Weirdly enough, the full extent of where the clitoris is in the lining seems to be a very debatable issue. You've done the cells and tissues lab. You know, looking at slices, you ought to be able to tell the difference between these tissues. My suspicion is it's highly variable from woman to woman. So somebody's looked at it and found that it's coats like most of the inside lining of the vagina, and some people find it's much more localized than that. It's like a lot of things, really different from person to person. That is the female system. We will cover pregnancy, but that will be the first part of going into the 3rd exam. So this is the last lecture going into the 2nd exam.